Hey everybody, it's Dr. Thom Green here from Elmira Family Chiropractic, and today I want to cover what a spondylolisthesis is, otherwise known as a spondylo, how to stabilize it, and other things that you should avoid when you have one of these. So first off, we're going to be dealing with the vertebrae in the low back, and what can happen is genetically or through repetitive strain, the vertebrae can start to slip forward. So it shifts anterior and starts to slide off the vertebrae below. Usually we see that at L4 or L5 most commonly, and causes, like I said, could be genetic, or we see it often in repetitive hyperextension type injuries like in gymnastics, car accidents, things like that. But this can be unstable, and that poses a problem, and if left uncorrected can lead to chronic neurodegenerative problems in the low back in particular. Oftentimes people report pain, numbness, tingling down the leg, or a pinching type feeling, especially when they bend forward into flexion. And so what do we do about it? Well, if you're noticing that, first of all, you should get a proper assessment from a chiropractor, and then we need to start to stabilize that. So at home, outside of the office, obviously chiropractic adjustments are going to help in these situations, but we need to address the stability of that area, because oftentimes we see that that segment can be unstable and can shift very, very easily. So if you get a pinch in your low back, what I tell people, the first thing to do is just get on your back. Lie down, put your feet up on the couch or on the side of a bed if it's not too high, and you want to flatten your back so that your back is flat to the floor. From here, you can just spend some time breathing right down into your tummy. You want to get full expansion of your tummy, your sides, and your back. As you breathe in deep like that, you activate your diaphragm, and then those core and breathing muscles are important for stabilizing your low back. So you can spend some time here, and when you're here, what's happening is that vertebrae that slipped forward, it's gone this way, it can start to slip backwards using gravity. So that can start to shift back into better alignment. Now, when you're here, what I recommend for some people, if you're up for it, is to add in a little bit of weight. So if you have an L5 spondylo or spondylolisthesis, then you can take some weight. I have a kettlebell here. This is about 25 pounds. Just make sure you've emptied your bladder, and then you can lower that weight down onto that segment. So your chiropractor should have shown you exactly where that segment is, and then you're just going to do some breathing again. And every breath, it's going to sink down a little bit deeper, and then that weight and gravity is going to help shift that segment back into better alignment. So you can hold this here for 5, 10, and ideally close to 15 minutes, because at 15 minutes, that's when we start to see those ligaments really start to stretch and change. And you're going to want to keep your hands on here so it doesn't shift or move too much when you're breathing. Other options, if you don't have a kettlebell, things like a sandbag, or just something heavier, could be even like a rock, just to hold and sit in place. I recommend anywhere, if you're just starting out, maybe 5-10 pounds, but over time you can gradually increase the weight, 15, 25, even 40, up to 40, 45 pounds, if you can tolerate that kind of weight. After you've done that, or during that, I also recommend you can use a wedge. So this is just a little wedge that we can slide in underneath the sacrum. So the sacrum is, some people call it the tailbone, but it's that triangle-shaped bone right between your iliac crest, and oftentimes this bone right here has a lot to do with that shifting of those lumbar vertebrae. And if we can start to shift that again backwards, then that's going to help open up the space in that low back and allow room for that vertebrae to slip back into place. So what you can do is take that wedge, just slide it underneath your sacrum like that, and then again with the feet up, just breathing, again allowing the low back to drop flat to the floor, and again you could add the weight in here and do that all together if you'd like. Now that's more of a passive component to starting to stabilize and correct that spondo. Now let's talk more about the active component and activating those muscles to again hold that vertebrae in place. So on your back again, simply holding those legs up in this position, knees about 8 inches apart, back flat to the floor, and focusing your breath into your tummy as that expands. And you don't want that to fully collapse at the end, because if you lose your core, you let your breath go, you lose your legs. So we want a little bit of intra-abdominal pressure to maintain that stability. And from here you can also add your arms in, so arms straight up from the shoulders, and then just breathing in this position. If you find this difficult, again, you can just put your feet on the couch and do some breathing until you get the strength to hold your legs up in this position. We call this 3 months supine. There's another video on our website and on our YouTube page that details this in more detail. But if you're able to do this for multiple breaths, maintaining that core stability, then you can start to add in some arm and leg movements. So slowly lowering an arm, maintaining that flat back, and not allowing those ribs to flare. What I mean by that is you'll see the rib cage start to flare out and you lose that low back. So you can see I got the hand underneath the low back. You don't want that. You want to keep it so that you can't get a hand under there. And slowly lowering an arm, bringing that back to center. You can slowly lower a leg down as far as you can without losing that core, and then bringing that back up. And you can just repeat doing opposite limbs, maintaining that stability for as many repetitions as you can handle without losing your technique and form. So that's 3 months supine. Another variation that you can add in would be with like a Bosu ball. So I just have a little pink ball here, or anything would work that's small and round, but just holding that up in that position. And you can even do a pass where you reach forward, pass, bring that back, and then pass it back to your feet in that position. Again, maintaining that flat back. Other things, glute bridge is a good exercise if you have a spondylolisthesis. So you want to put your feet close to your bum, knees bent, and then you're going to squeeze your glutes and lift your pelvis up in the air, maintaining your shoulders on the ground, and then repeat, do that 10 or 15 times, 3 or 4 sets of that. Other things to think about, things like side plank, on your side, doing a side plank. Some people ask about doing crunches. Crunches are fine, just try not to do a big sit up if you're doing a crunch. Just keeping that, again, core flat, and just lifting the shoulders off the ground. Not going too high into that full sit-up position. Now, what are some things that you should avoid if you have a spondylo? We recommend avoiding anything where you get into hyperextension. So some positions like a Superman, where you're up like that, where you're hyperextending, that can cause more pinching and aggravation of the spinal cord and the nerve roots in the low back. Or again, hyperflexion, so sometimes bending all the way over, just being careful in that position. If you're in the gym doing a GHD or glute ham developer, again, just be careful with any of those type of movements. If you have any questions, please feel free to ask me. There are other things that we can add on to this to, again, engage the core more. And if you're looking for those, go to our website under our video library in the core section, or on our YouTube page. We have lots of great core exercises to continue on with what we've started here. Hope this has helped. Have a great day.